So much for that, Amanda. We are going to find out lots about, well, as much as we can about Omicron in just a few seconds. It's interesting. This morning we've heard that in the UK they're bringing forward their booster shots, right? So they were going to have to wait 6 months to get a booster shot, now 3 months. And in Australia, they are delaying opening the borders up by 2 weeks. So different approaches. One trying to keep Omicron out, the other hoping that the vaccine will stop the virus, even though we don't know whether that's possible yet. 12 minutes after 8 now, let's find out more about it. And let's go to our expert this morning, Dr. Margaret Harris, who's with the World Health Organization. Good morning.
Good morning, Ryan.
Thank you so much for joining us. What do you make of these moves so far? Kind of different strategies from Australia and the UK. In the UK, they're bringing forward the boosters. In Australia, they are pushing out opening their borders. What do you make of those moves?
So for us, we'd prefer not to see big travel restrictions. But if countries do impose them, we'd like to see that they use that time to really strengthen their surveillance and their hospital systems. But there is a lot of concern that Southern Africa has been really isolated by a lot of the reaction worldwide. The critical thing really is to learn more about Omicron, where it is, and improve the testing and tracing that's being done everywhere. In many countries, that system has almost been dismantled or really not been as strong as we'd like it to be.
Where's it been dismantled?
In some countries in Europe, they stopped doing all the testing and tracking. There was a bit of complacency, an assumption that they'd somehow got this virus beaten. Now, the epidemiology didn't support that. Europe's in the middle of an enormous outbreak, huge surges, terrible death rates, hospitals full. But for some reason, there seemed to be a belief that this thing was somehow beaten.
I think people get tired, don't they? You know, you get halfway through a war and you're just over it.
Yes, I think so. The novelty was definitely over, and it is exhausting. It's people have been really good and have really put in a lot of effort to try to prevent the spread. Unfortunately, we've got to keep on doing that. Okay,
so let's talk about Omicron then. And is it fair to say that, it looks like it spreads faster than Delta, but it's not as lethal? Can we say that yet?
No, we can't. So some of the information that people are basing that on is because the early clusters were in students, were in young adults, young healthy adults. And as we know around the world, that particular age group tends to have mild illness, often asymptomatic illness. So that doesn't tell you what's happening with Omicron. That just tells you that a large number of young adults got infected. We need to know a lot more about characteristics. We need to look at who's in hospital. Do they have Omicron, and were they vaccinated? And we need to understand how those who've been vaccinated, whether the antibodies they've produced can neutralise this particular version. So there's a lot of research that has to be done.
Given we don't know that yet, is it smart for the UK to be bringing forward booster shots?
So again, indeed, we would prefer that boosters not be used because we actually want those vaccines to be used in the rest of the world. The reason we're getting variants developing, they are developing in countries where the virus is running rampant, unchecked by immunity, because so many countries have not been able to get an adequate supply of vaccines. So we want to see the vaccines going to the rest of the world. And the real message here is that if we don't address the terrible inequity, this may just be a dress rehearsal. We may have a much worse variant come along.
Gosh, that's frightening. So basically, because our government's going to be faced with this challenge at some point too, now that the UK's pulled the trigger, there'll be calls here, oh, look, New Zealand, you should bring forward your booster shots too. Your message would be no, give those doses to the developing world and we can stop this thing from happening again.
We would say that. We'd also say make sure that all the people who are yet to be vaccinated, the people you really want to see vaccinated are the ones who haven't had the first shot. You want to make sure that in every country, even the countries that have got very high coverage, you still have big pockets of people who are not certain they want the vaccine, haven't had an opportunity to get it. It's been difficult for them to either get to where the vaccines are being given. You need to address those things and make sure that everyone in your population is getting the full course before you even think about boosters.
When you look at the number of deaths, New Zealand has, compared to the rest of the world, we have very, very few deaths. The mortality rate here is very, very low. We have been very successful in avoiding deaths, large numbers of them from COVID. Is that the measure of success when you're going through a pandemic?
That certainly is a very important measure of success. I mean, if this virus didn't kill people, if it didn't put people in hospital, it would be an inconvenience rather than the threat it is. And keeping people out of hospital and looking after them and preventing them from dying, that is the most important thing you can do.
The other thing, of course, to do alongside that is make sure that you're increasing your hospital capacities, your ICU capacities, etc., in order to deal with potential future outbreaks that you're describing.
Absolutely. And especially now that we know we've got a new variant that we're concerned about, it's an important time to look at your capacities and what you can do, what kind of backup you've got, because you also want to keep your health system going for other things. We have all sorts of other illnesses, diseases that you need intensive care capacity for. So it's essential that you ensure you've got that backup.
Yeah, totally. Can I ask you a very quick random question? I obviously didn't prepare you for this, but, there's this theory people have that the viruses like this are sent here to control the population by Mother Nature or whatever, because we are destroying the planet. And that is an existential threat to us as a species. So perhaps in some wacky way, this is actually good for us as a species and for the planet. Do you have a view on that?
That's not a silly question at all. In fact, we have seen as humanity has encroached on Mother Nature, we've seen an ever-increasing number of jumps from the animal kingdom to the human kingdom. It's very clear that the way in which we're interacting or interacting negatively with the rest of the biosphere, all the other creatures that have to live with us, that we are creating more and more opportunities for viruses that are going to harm us. Also, the way we crowd in cities, the way we work, the way we live, we're setting ourselves up for this kind of massive viral explosion. And again, we have been predicting this for about the last 20 years. All my time I've worked with WHO, I've written 1 million documents saying this is likely to happen. So indeed, pay attention, people. We don't want to have another pandemic like this or an even worse one.
Dr. Margaret Harris, thank you very much for your time this morning. We really appreciate it. The World Health Organization representative with us this morning. It is 19 after 8.